Have you ever felt a sudden stabbing pain in your back or side? The kind that makes you stop breathing for a moment. Most people assume it's a muscle spasm, but sometimes it's a scream from deep inside, the voice of a kidney stone. It might be as tiny as a grain of sand, but when it moves inside your urinary tract, it can bring even the strongest person to the knees. According to the World Health Organization, 1 in every 10 people will experience a kidney stone in their lifetime, and it's rising fast, caused by low water intake, poor diet, and a sedentary lifestyle. At the end of this video, you will learn about one simple daily habit that can prevent kidney stones from ever forming. Your kidneys filter about 180 liters of blood every day, removing toxins and waste to produce urine. Each kidney connects to a thin tube called the ureter, which carries urine down to the bladder before it leaves the body. When we don't drink enough water, or when minerals like calcium, oxalate, or uric acid become concentrated in the blood, they begin forming tiny crystals inside the kidney. Over time, these crystals fuse, and that's how a kidney stone is formed. Most stones stay silent for months or even years until they move, and when they do, the pain is unforgettable. But how exactly do these stones form? What turns a mineral into rock inside your body? You will find out in the next chapter. The main cause of the kidney stone is mineral imbalance. When there is too much calcium, phosphate, or uric acid in the bloodstream, these elements no longer dissolve properly. They crystallize. Small crystals stick together, gradually forming a stone. If the stone is under 5 millimeter, it often passes naturally with urine. But if it grows larger, it can block the ureter, stopping urine flow and building dangerous pressure inside the kidney. That's when severe pain, nausea, and blood in the urine begin. According to the medical research, there are 4 main types of kidney stones. Calcium oxalate stones, most common, and is caused by high salt intake and oxalate-rich diets. Uric acid stones form too much red meat or protein. Struvite stones due to frequent urinary infections, and cystine stones caused by genetic disorders. Comment below, did you know there are actually 4 different types of kidney stones? In the next chapter, we will learn what warning signs your body gives when stones begin to grow. The dangerous thing about kidney stones is their silence. At first, there are no symptoms until the stone starts to move. The first sign is sharp, cramping pain in the back or the side. It comes in waves, sometimes shifting from the lower abdomen to the groin. The second sign, burning or blood in the urine. As the stone scrapes the urinary tract, you might notice reddish or cloudy urine. Fever, chills, or foul-smelling urine occur. It means infection has joined the battle. Another common symptom is nausea and vomiting. This happens when toxins re-enter the blood because the kidney is under pressure. And perhaps the most dangerous sign of all, fear of drinking water. Many patients avoid water because pain follows urination, but that's the worst mistake possible. In the next chapter, we will see how doctors identify stones and what tests reveal the hidden truth. When a patient arrives in pain, the first step is diagnosis, finding the root cause. An ultrasound helps locate the stone and estimate its size, but when small or hidden stones are suspected, doctors use a CT scan, the most accurate test capable of spotting even 2 millimeter stone. Blood and urine tests help determine which minerals are out of balance: calcium, oxalate, phosphate, uric acid. For patients with recurring stones, metabolic evaluation is done, a complete analysis of the body's mineral chemistry. In the next chapter, we will face the moment of truth, when the pain becomes unbearable and emergency action begins. The pain from a kidney stone called renal colic is among the most severe known to medicine. The first and the most important step is getting medical help immediately. Never rely on home remedies or wait for it to pass. In the emergency room, doctors give pain relievers and IV fluids to ease pain and help flush the stone. The stone is under 5 millimeter. It often passes naturally, a process known as medical expulsive therapy. But if the stone blocks the urine flow or causes infection, it can become life-threatening. In such cases, surgery is necessary. Have you or someone you know ever experienced a kidney stones? Share your experience in the comment. In the next chapter, we will explore how modern medicine can destroy stones without surgery. Today, treating kidney stones is safer and faster than ever. If the stone is small, doctors prescribe medications, painkillers, alpha blockers like tamsulosin, and increase water flow and intake. It helps to pass it naturally. For larger stones, ESWL, extracorporeal shockwave lithotripsy, is used. A machine targets the stone with shock waves, breaking into tiny pieces that exit through the urine. No cuts, no stitches. If the stone is trapped in the ureter, ureteroscopy is performed. A thin scope enters the ureter and a laser breaks the stone. For very large stones, PCNL, percutaneous nephrolithotomy, is used. A small incision in the bag allows direct removal. All these methods are effective, but prevention is still the best cure. Next, let's learn how diet and water habits can keep your kidneys safe. Research shows that drinking 2 to 3 liters of water daily is the simplest way to protect your kidneys. Water flushes toxins and prevents crystals from sticking together. Limit salt and processed food. Too much sodium increases calcium in the urine, raising stone risk. Avoid cola drinks and high-protein diets. Instead, eat citrus fruits, lemon, orange, grapefruit, rich in citrate, a natural stone inhibitor. Balance meat and lentils. Too much protein raises uric acid level. Exercise regularly. It improves blood flow and helps kidney filter efficiently. How much water do you drink daily? Can you commit to 3 liters a day? Comment below. Now let's bust the myths surrounding the kidney stones. Let's clear some common misconceptions. Myth number 1. Kidney stones always cause pain. Fact. Many remain silent for years and are found only during scan, called incidental finding. Myth number 2. Lemon juice alone can dissolve stones. Fact. Lemon helps but does not cure large stones. Medical treatment is essential. Myth number 3. Once removed, stones will never return. Fact. If diet and hydration are not corrected, they will form again. Myth number 4. Only men get kidney stones. Fact. Cases among women are rising, especially post-pregnancy. Myth number 5. Home remedies can replace medical care. Large stones require surgery or laser treatment. No shortcuts exist. Now, let's talk about a story of David, a 38-year-old office-going person. One day, unbearable pain struck his back. At the hospital, scans revealed an 8mm stone blocking his ureter. Doctors performed a ureteroscopic laser procedure and broke the stone. Within 3 days, David was walking again. Now he drinks 3 liters of water daily, avoids excess salt, and teaches others. Water is life. Neglect is death. His story is our reminder. We are also so busy working, we forget to listen to our kidneys. Water isn't just refreshment, it's protection. If you stay hydrated, eat right, and stay active, stones will never return. Thank you for watching. Comment below, do you track your water intake every day? Share this video, it might save someone's life. I'm Dr. Raza, and you're watching Dr. Raza Health 360 ND. Your better health is my mission. See you later. My name is Dr. Raza. I am a practicing family physician in USA for the past 18 years. I am an American board-certified physician and diplomate of American Board of Family Medicine.